Hey everyone, in this video I'm going to talk about exam related topics of lower limb part of anatomy. There is a lot to cover in this chapter, but some topics which easily lets us score needs a mention. You are free to take screenshots of the slides and ignore my talk, but I suggest you to hear me out if time permits, as I'm going to add extra little advice and tips to every topic as to how their answers must be written to get good marks. So without wasting time, let's start. So the topics important for short notes are sciatic nerve, the root value, course, branches, and the muscle group supplied by each branch is important. Then is the arches of foot. The branches, the supply, and the diagram is also important. Next is hamstring muscles. The origin, insertion, action, and nerve supply of these muscles needs to be mentioned. From the femoral triangle, the diagram, the boundary, and the contents are important. And the clinical aspect of each and every content needs to be mentioned. Next is popliteal fossa, the boundaries, contents, and the arrangement of the artery, vein, and nerve in the three parts of the popliteal fossa are important. Next is femoral sheath and femoral canal. It is related to femoral triangle. You'll get to know after studying it or after I teach it. Then is adductor canal, which is a continuation of femoral canal. So without getting the concepts clear about the femoral triangle and the femoral canal, you cannot move on to the adductor canal. So the contents of the adductor canal and the boundaries are also very important for clinical point of view too. Then is great saphenous vein. It is one of the content where it originates from the femoral triangle, again related to the femoral canal and the adductor canal. Then is the lateral compartment of leg. The action, origin, insertion, nerve supply, and the names of various muscle groups, the superficial layer and the deep layer important. Next is femoral artery. It is very important to know about the origin, the location, and the branches of femoral artery, where it's positioned in the leg and the thigh, because it's very important clinically, as it's the artery used for embalming the cadavers and also inserting pacemakers in cardiac patients. Next up are the main nerves of the lower limb, which includes the femoral nerve, obturator nerve, accessory obturator nerve, superior gluteal nerve, inferior gluteal nerve, nerve to quadratus femoris, nerve to obturator internus, sciatic nerve, tibial nerve, common peroneal nerve, deep peroneal nerve, superficial peroneal nerve, and the plantar nerves are needed to know about all the course and the supply. Next are the main arteries and their branches, which include the femoral artery, which is seven branches, then popliteal artery, anterior tibial artery, dorsalis pedis artery, posterior tibial artery, peroneal artery, medial plantar artery, lateral plantar artery, and the plantar arch. The structures passing through greater and lesser sciatic notch are very important. It should be in the tongue tips of the students because it's the favorite question of examiners in the theory as well as in the viva. Then in the layers of soul, it's very important to know not only about the names of all the four layers of the soul, but also their action. Then is the venous drainage of lower limb, starting from the toes and the fingers to up to the great saphenous vein where they finally drain. And the blood supply of the neck of the femur is very important with respect to the clinical aspect, as fractures of the neck of femur leads to necrosis and various other problems. There is a superficial inguinal lymph nodes. Nothing much needs to be said about this. It's much self-explanatory. Then is the femoral hernia. It is the very important topic, be it inguinal hernia from abdomen and pelvis to femoral hernia in the lower limb. It's very important if the examiner wants to ask a clinical question from the lower limb part. Then is the flexor and retinaculum of foot, which is also very important, like the flexor and extensor retinaculum in the upper limb. Now, moving to the topics important for long notes, there are three topics like structures under cover of gluteus maximus, hip joint, knee joint. The first two are very important. Knee joint can be left but also need to be studied. There's a 50-50 chance it might come in the exam. In the structures under cover of gluteus maximus, the muscles, vessels, nerves, bones and joints, the ligaments, bursae, along with the proper diagram, need to be done in the exam. Then and then only you're going to get the marks, at least if you're aspiring to get 10 marks out of 20. Then is the hip joint. There's a lot to cover in the hip joint, along with the diagram, the supports, the nerve supply, the blood supply, and all the muscles that are providing support and stability, which is the part which is clinically more fragile. All and everything about the hip joint is important. It makes a complete compound question of 20 marks. Then same goes with the knee joint. It's a bit complex, but the hospitals and the orthopedics department are always filled with the patients having knee joint problems. So, as a med student, you need to know each and everything about knee joint, because in your family itself, there are people, your grandparents, who are having knee joint problems. So, this was it from the lower limb part of anatomy. The important topics of other chapters are also available in my channel's playlist. Do check them out, and thank you.